Welcome to everyone who's coming in. Great to have you. And you'll see that people are just putting into the chat where they're coming from today, their name, their organisation, where they are, and what their involvement has been in partnerships between faith and public services. And it sounds like we've got a nice geographical spread across the country. Which is great, and a nice mix of people who are involved in partnership work that involves a funding relationship, and people who are connecting together and signposting and referring, but also some people who are here to learn more and explore more, which is also great to have you. Yeah, and great to have a mix of people from faith context and then also those from public services as well. So thank you so much for joining. Great. I think we'll probably have a few more people filtering through, but so that we can make the most of our time together, I think let's get going. I am Esther Platt. I work for the Good Faith Partnership, and myself and my colleagues Ellie and Alicia, who are here today, we work on the ChurchWorks Commission. For those of you who haven't come across ChurchWorks before, Ellie, if you could just pop to the next slide. ChurchWorks exists of 16 commissioning organisations, which are represented by senior church leaders that span the breadth of the church in the UK, and our vision is to help churches and Christian organisations to collaborate with one another, and then also to collaborate with the government, and we do that around the three main priorities of well-being and mental health, vulnerable children and families, and poverty. And that looks like events, conferences, webinars, research projects, and we love to partner and have conversations with people across the faith sector and those in government and public service. In terms of, although that's a picture of our commissioners, a commissioner meeting. And in terms of what we wanted to share today, we have over the last couple of years been able to do some research work collaborating with partners and developing resources to enable faith groups, so church but also other faith groups beyond churches, to partner with local public services. And so today's conversation is going to be split into two halves. We'll start off by talking about social prescribing, and then I'll pass over to my colleague Alicia to talk a bit about children and families and family hubs. And in those parts of our conversation today, we're going to talk through some of the context, the opportunity for faith groups and public services to collaborate. We're really happy that we've got a couple of people who are going to share about how they have done this, and we've also got some resources to share with you. So I'm going to kick us off by talking about social prescribing. And when we first started doing our work around social prescribing back in 2021, we obviously weren't at the point where we are now, where we have this neighbourhood health plan. And I imagine that lots of you have heard these details about the NHS 10-year plan. The plan kind of outlines these three shifts that the Department of Health want to see. So from hospital to community, from treatment to prevention, and from analogue to digital. And it's all around this idea of a neighbourhood health service, that individuals should be able to access the support that they need as close to home as possible. The emphasis is on having this local care in communities, on having multidisciplinary teams, and there being a kind of integration in the delivery of these services from the Integrated Care Board, which is the kind of regional body in the NHS, local authorities, the VC SFE network and sector. And while the neighbourhood health teams are going to be something that is, and the neighbourhood health service is something that government want to see in all communities, there have been 43 places that have been selected to start as wave 1 of implementing this, starting now. So a key part of the neighbourhood health service is the neighbourhood health teams, and these teams starting with those 43 places are going to be made up of GPs, nurses, social workers, social prescribing link workers, pharmacists, people from local government teams, and then also individuals and organisations working within the voluntary sector as well. The vision around it is for people in communities to be able to get end-to-end care, so to be able to get a kind of continuous support throughout the time that they need help with their health, and for that to be tailored and adapted to them, rather than being sent between lots of different professionals and lots of different services. It will be better integrated and easier for them to access. Initially, there's going to be this focus on diabetes, arthritis, angina, MS, and epilepsy as key conditions that the focus in neighbourhood health teams will be on, but hopefully the plan is for that to be expanded. There's also within the NHS 10-year plan, there was the idea of neighbourhood health centres, which will be places where these neighbourhood health teams can be based, and they have been described as a one-stop shop for patient care, that you can go in and get whatever help you need, whatever kind of primary care help you need with your health. And as I've said, in terms of integrating with the voluntary and community sector, the focus with this neighbourhood health service is to provide for people the healthcare that they need, that is near to their home and is accessible and is integrated, but also to respond to the needs around those wider determinants of health. So that's why the voluntary sector is going to be integrated into these neighbourhood health teams, so that if you come to your neighbourhood health team and you have a significant problem with debt, or with getting into work, or with loneliness and isolation, you know, all of those sorts of things, you can access people to help you with that, to improve your overall health. So that's a bit of a whistle-stop tour of kind of the context that we're in at the moment around the NHS 10-year plan. It's a very long definition, but I've been assured that it needs to be this long in order to be comprehensive, of what social prescribing is. Social prescribing is essentially about enabling individuals who perhaps come to a clinical setting, but who need support that isn't medical or clinical, but impacts their health. It's about prescribing, connecting them in with activities, communities, support that can enable them to get better and to take care of that part of themselves. So it's about kind of producing a social prescription to improve their well-being. And so practically what that looks like at the moment is social prescribing link workers are often employed to work in a GP setting, or they might be in a community setting like drop-ins or community cafes, and they will meet with people who have been identified as having a need that is beyond a kind of something that can be dealt with in a purely medical way, and they'll then refer them to local community services that can meet their need. And in terms of the kind of how this fits in with that neighbourhood health system, social prescribers, so prescribing link workers, will be part of those integrated neighbourhood teams. So at ChurchWorks, we did this research over 2023 and 2024 with the think tank Theos, and this research was called Creating a Neighbourhood Health Service, the Role of Churches and Faith Groups in Social Prescribing. And what we wanted to do in that research was to understand what's the relationship between faith groups and social prescribers locally and nationally. Where are the advantages in terms of faith groups being connected into social prescribing, and where are there barriers? How might that be improved upon and expanded? And of course, while we are now talking in terms of this NHS 10-year plan, the neighbourhood integrated neighbourhood health teams, when we were doing this research, that plan wasn't the case, and we were kind of talking with link workers who are mostly based in GP surgeries or in different community settings. So what does that look like? Well, we talked to lots of different churches and faith groups and link workers, social prescribing link workers, and other health professionals. And we kind of created this list of different activities that faith groups run that could be socially prescribed to. And that is a page just sort of lifted out of our report that you can see that list there. So lots of things that I'm sure you will recognise as things that faith groups offer, but which can be really valuable for someone who is isolated, who is experiencing poor mental health, who needs additional material support, who would benefit from doing more exercise. All of those things, these services can meet their need. And there's a quote here from our research from a social prescribing link worker who is kind of saying, I think a lot of faith leaders have kind of been doing social prescribing for quite a long time, because people would come to them and they would sort of have a kind of link worker role in terms of connecting people to the support that they need. And so this kind of offering services for the community based on need is something that faith groups are actually really familiar with, and that we've been doing for a long time. So in terms of the opportunity and the benefit of faith groups engaging in social prescribing, there are 4 things that we outlined in our report that we think are the 4 kind of assets that faith groups can bring to engaging with social prescribing and linking into the neighbourhood health service. And the first of these is that faith groups are very often anchors of the community. We're a consistent presence in local communities, often in a recognisable building, so a kind of physical presence in that way, but we have a consistent membership. We have people who are going to be there, people who are part of the community, who know that place, and as this community worker said in our research, they're there because they want to help. And so while of course funding and the logistics of kind of running community services are really important, faith groups will, because of the reason why they're running these support services, will be there and will do as much as they can to support people, even if there isn't funding or particular support available for them to do it. And so the value of faith groups is being that kind of anchors in the community, being consistent, being recognisable, being that place that people know is just going to be there and they can go to. The second thing is that faith groups have the ability to network, to convene, and that's part of being a kind of recognisable and defined community, that faith groups are able to reach out and to connect with other organisations and with other networks, and whether that's kind of interfaith collaboration or beyond faith groups and with other community groups as well. But there's a real kind of value in faith groups' ability to do that. The next one is very kind of practical, that faith groups have often have buildings and they have volunteers, and anyone who sort of was a little bit familiar with the Darzi report that came out last summer, kind of outlining the problems in the NHS at the moment, will know that lack of buildings and lack of space to actually provide health services was a key thing. And so the fact that so many of our faith groups have physical buildings that people can use, and that they also have access to volunteers, to people who are happy to be there and to give their time to others, is also a huge asset when it comes to supporting people in the community. And then finally, one of the opportunities and the assets that we have as faith communities is around our expertise in pastoral and spiritual care. That so many faith groups across the country, many faith communities, are places that are kind and caring, where the people who are there are not trying to fit as many people as they can into a particular service. They are just there for people to be themselves, to be heard, to have a conversation, to talk to people. And they also provide a space where it's okay to have those bigger questions about life. And there are people who can listen to you and have those conversations. So those are the kind of 4 key things that we think faith groups have that set them up really well to be able to engage in social prescribing. And our report, which we'll put a link into the chat when I've finished, our report kind of outlines some recommendations, which I won't go into a lot of detail now, but they are all about relationship building, and that actually, in order to make the most of these really good things that faith groups have on offer, and in order to connect that well into social prescribing in the neighbourhood health system, we think it's all about relationship building. And we put that into 3 sections: active networking. So just like knowing, for a social prescribing link worker to know who their local faith groups are, who their local faith leaders are, and to be in communication about what they have on offer, or maybe when they're going to prescribe someone to come along. And also things like forums at a kind of local community level, bringing together health professionals and then also faith leaders, and just having a conversation about what are we seeing at the moment in our community. We also recommend engaged partnering, which is looking at a kind of like slightly longer term, thinking about what's the need in our local community, how can we partner across the health provision and then also our local faith groups. And then finally, forward planning. So thinking about actually, if we're bringing together a neighbourhood, an integrated neighbourhood team, how can we hear the voices of faith groups and bring in their expertise and their perspective into that planning as we think about how we serve our local communities. So those are our recommendations, and they're in much more detail in the report, and we kind of spread them across the kind of neighbourhood level, a place-based level, so sort of your towns and cities, and then systems, which is that kind of more regional level of recommendations. So just briefly, I want to tell you about our how-to guides that sit alongside our report. So yeah, great, thanks, Ellie. So we wrote our report, and then we created 2 how-to guides, which they're in the same place on our website, which I will share. And we wrote 1 how-to guide for social prescribing link workers and 1 how-to guide for faith leaders. And within those, what we have done is we have condensed what we learned in our research and condensed what's in the report in terms of how do you kind of build relationship at that really local neighbourhood level, and we've distilled that into these guides. And so I've just taken some screenshots here of the parts of those guides that we've got, the kind of some key steps that you can go through. We've also got FAQ pages in case you have some questions about how social prescribing works. We've put a list in the back from our report of all the different activities that faith groups might be doing that would be helpful for social prescribing link workers to know about, so that you can have a look and think, oh, maybe there are some of those that we do. And then we've also included this local activities fact sheet, which we have included in both guides. And we created that because we wanted to just give faith leaders something that they can go to, write out. You can just go to this fact sheet. There's a printable on our website as well. Write down the details for your activities and what you do. And then you can give that to your social prescribing link worker and give them all the information that they will need to be able to have an understanding of what you offer and who might be appropriate to refer to the community activities that you are running. This is the QR code will take you to our website, and both of these links will also take you to the website that has our report, our how-to guides, and the printable for the fact sheet. And I'll also just pop that link into the chat as well. But before we move on to thinking about family hubs, I'm going to invite Sarah from Shine West Bowling to come and to just share a little bit about her experience as a church sharing, engaging in social prescribing. So over to you, Sarah.
Thank you. It's really lovely to be with you all and just share a bit. So I'm from a charity called Shine West Bowling, which is based in a church in inner city Bradford. It is not a big church at all. So we have about 60 people on a Sunday. So don't feel that this is a very large church with lots of capacity. It's not. But from that, we were extremely aware of the need around where we are, and have developed this charity, which has slowly grown over the years, to be able to offer things such as food. So we run like a pantry in a couple of places each week. We have a children's clothes bank. We run lots of art things for people with mental health difficulties. But do you know, the most important thing that everybody will say again and again and again is just that we are an open place for people to come. So like the initiative of Warm Welcome or something like that, we were doing that before that came about, but that is the most important thing that people have said they want. We get through, I mean, I just can't begin to tell you how much tea, coffee and sugar we get through each week. But that is the most significant thing, that we have a boiler that is on all the time. We have a door that is open. And we are offering that welcome, which I think that we as church groups or faith groups are so good at doing. And that so many people need in our society today. So having done that, when we started to hear about social prescribing, we thought, well, we're doing this, actually. Let's try and get hold of our social prescribers. So we have gone through going to GP surgeries, making ourselves known, and I think actually the most important thing that we do with social prescribers is that we ask them to come and see us, because there's an awful lot of people who haven't been in a church building ever or for a very long time. And I think they struggle to get their heads around how welcoming a church can be. So I would always suggest that if you get in touch with a social prescriber, you say to them, please come down and see what we do. And I would say that every social prescriber that has been down has just been gobsmacked, actually, because they can feel it as they walk in the building, as you can with so many churches, that sense of welcome and acceptance for whoever is coming through the door. Other things that we've done, I think, that have been very easy to do is that we have become a place that the doctor's surgeries particularly have asked us to do, and a place that so people can be helped to get on a computer and book appointments actually digitally. And the doctor's surgeries gave us an extra computer to do that. And they said, can you just be alongside the people who can't manage the digital stuff that we want to happen now in our doctor's surgeries? So we've also done that. So that again has been simple. We have a telephone again that is available for people to use. So those are the really simple things that I would say our social prescribers value hugely. So the welcome to stop the isolation and the loneliness, which is often what they come across, and just those little practical things about we have many people who can't manage digital things, or they just struggle with literacy. Or do you know what? I think that we come across so many people who don't have the confidence to speak on the telephone actually, or they've lost their passwords and then they panic. And because everything has to be done digitally or on the phone these days, those are the people who really struggle. And I think quite often end up at the GP surgery very anxious because they are just not managing with the day-to-day managing of how life is and how we have to do things in these days. So that is sort of that, alongside a bit of finance advice that we can sit with people, we can help them fill out forms, things like that. I would say that are probably the things that the social prescribers value more than anything. I mean, we can give food sometimes to people. We have decided to put a shower into the church, so we now can offer shower facilities to people who need that. But the biggest thing is tea, coffee, sitting on a sofa, somebody to talk to them, and being able to help them with these digital things or with phone conversations. I would say it hasn't always been straightforward. So I think probably from what I gather, if you are in some settings, you have just one surgery that you go to within the location where you are. We have multiple surgeries where we are because we're in a city, and each surgery has different social prescribers who come and go. And that has been quite hard because there seems to be quite a frequent turnover, or it is trying to find who we really, really need to communicate with. So I think don't think it's going to always be straightforward, but the opportunity for us to be making a difference as churches is, I think, wide open at the moment. The need, certainly, we're in a city, the need is in our face, but we all know that the need is increasing, and the NHS cannot cope with that need. And we're there, aren't we? We can do it, and we know that we can do it well. So yeah, I would encourage you to go out to find out who social prescribers are, and to engage them. But most of all, the most significant thing I think is just get the social prescribers to come into your building and to see what's happening, talk to them, and to see what else they need, because they're coming across that need day in, day out. And we will be able to help in many ways.
Brilliant. Thank you so much, Sarah. Yeah, it's really great to hear the things that you've been offering and how much of a difference that makes to the local community. So thank you so much for being with us and for sharing that. Just before I hand over to Alicia, I just quickly wanted to clarify. apologies if I have muddied the water at all by talking about the NHS Health Service and then also talking about social prescribing. So social prescribing has been part of the NHS since 2019, I believe. So there are social prescribers at the moment in every community, but they'll be based often in GP surgeries. The neighbourhood health plan and those integrated neighbourhood teams are going to be a slightly different way of working. And so those social prescribers will be part of these integrated teams that will also then involve people from the voluntary and community sector. And so there's this opportunity right now to engage with social prescribers, as Sarah has shared, but I think there will also be increasing opportunity in the future for faith groups to not only be connected into social prescribers, but also to be integrated into the conversations that those neighbourhood teams are having. So I hope that makes it a little bit clearer, and our how-to guide kind of just has a couple of suggestions of how you might be able to find out who your social prescribing link worker is, because as Sarah said, it is different in every locality, but often your GP surgery's website will be able to tell you who your link worker is. I'm going to hand over now to Alicia, and we're going to move from social prescribing and health to family hubs. So thank you so much, Alicia.
Brilliant. Thank you, Esther, and thank you, Sarah. Yeah, so we're going to change tack slightly, but consider another great opportunity for how we as the church and as the faith sector can partner with local services, which is family hubs. And before I get into why the current political climate might be a great opportunity to consider this partnership and what that partnership could even look like, I'm just going to start by explaining briefly what family hubs are, in case that's new to anyone, or to briefly remind you. So family hubs were launched in 2021 as a Conservative government initiative. And I think a helpful way to understand what they are is that in many ways they're the Conservative kind of version of Sure Start centres, but with a key few differences. The first being that rather than providing just early years support for 0 to 5s, family hubs hope to provide support for families with children aged 0 through 18 and even up to age 25 if they have special educational needs or disabilities. The other key difference is that family hubs have this kind of one-stop shop model where they aim to provide the full range of holistic support that a family might need when raising that child from day 1 to age 18. Think infant feeding support, support with your teenager with their mental health, or even the kind of wider holistic things that affect a family's well-being, like accommodation advice. Family hubs try to offer the kind of full range of support that parents might need in raising children, and it takes place through a mix of physical spaces, through kind of signposting and referring to other stakeholders that provide support in the local community, and then also a kind of digital online presence as well in many local authorities. So recently, just this summer in July, the Labour government have committed to the family hubs model and are expanding. So they've invested over £500 million into the model. And currently, whilst there's just been 75 local authorities that have hosted family hubs, that's going to be expanding. We're going to be seeing rollout across the country with a family hub in every local authority in the next 6 months, with a total of 1,000 new hubs by the end of 2028. So there's a real opportunity at the moment, which is why we think today is a really great, kind of time to highlight this, because with the huge rollout, there's opportunities for faith groups to consider how they can partner. As ChurchWorks, we've been exploring this partnership since the kind of genesis of family hubs back in 2021, and I've been really pleased to work with some key partners of ours, including the Gather Movement and Spurgeon's, and with the National Centre of Family Hubs, to begin to explore what partnership between the faith sector and family hubs can look like. And much of that came from a call to action, actually, that Dame Andrea Ledson provided. She attended a ChurchWorks commissioner meeting, like we saw a photo of earlier, back in 2022, and shared with our commissioners how integral working with faith groups will be to see success, to see family hubs be as effective as they can be. And I think since then we've just been trying to respond to that call and see what can that look like and explore that further. I think there's quite a few reasons why faith groups have many of the ingredients needed to work alongside family hubs and to partner with them. As Esther mentioned, in the case of social prescribing, we as churches and as faith groups often have buildings, often have volunteers who are ready and eager to love and our communities well. But the other thing I really want to emphasize is that faith groups and the church have loads of existing services that already are supporting children and families and young people in our communities. Think of church toddler groups, for example. The Gather movement recently did some research and they found that 52% of children in the UK have benefited in some way from a toddler group hosted in a church building. And I think we see this anecdotally in our neighbourhoods and communities, that there's so much provision coming out of the faith sector to support families. Think about your toddler group in your church hall, maybe the youth club that meets on a Friday evening. You might have a parenting class, maybe a support group for parents. There's all sorts going on. And I think what I'd love to highlight is the opportunity with family hubs is not a new thing that we need to start and corral our volunteers to join, but actually something we're already doing. And through considering partnership, we can add value to the existing work that we're doing, the existing relationships we have with our communities, which is really exciting. In addition, faith groups don't only have the tangible assets, but also I think there's quite a lot of synergy between the values that drive faith groups' work with children and families in their communities and the values that drive the family hubs model. The three words that the family hubs use to describe their mission, their values, are access, connections, and relationships. And I think in the church we might use different language, but actually there's quite a lot of overlap. Maybe we'd say hospitality, building communities, loving God's children. But we share a kind of person-focused, holistic attitude where we want to, meet those around us and support them in their range of needs, support them as individuals rather than just kind of offer a service or tick a box. And that's something that I think faith sectors have and hold, and then also the family hubs model really champions. I've put a quote there trying to highlight this because it's not just us, I hope, that have recognised the potential and the kind of potential synergy to allow for partnership. Here, Jane from Coventry City Council, she shared this same sentiment. Churches and faith groups are ideally positioned for showing us how to love families well. A huge benefit of partnering with them is that they are where people are already receiving support and have built trusting relationships. And I hope that can just highlight, that you're already doing it, that actually if you look inside your church, in your neighbourhood, in your community, that there's already so much going on that could partner with family hubs. I think this opportunity for partnership is particularly amplified in the current moment. As I mentioned, there's going to be 600 family hubs opening in the next 6 months. And something that particularly interested me is when looking through the kind of family hubs policies, there's a large emphasis on the stay and play model as an important facet of a family hub. As I said before, we know the importance of churches and the faith sector in providing stay and plays. And I wouldn't be surprised if local authorities across the country are going to be reaching out a hand for partnership as they hope to open 600 new stay and plays, to find locations for those, to find volunteer teams. And I'm sure in your community, there are already faith groups that are facilitating those. So there's huge potential for partnership there. Now that I've highlighted some of the kind of context of family hubs and some of the opportunity that we currently have to see partnership, I'd love to share with you a resource that we as ChurchWorks have created with some of our partner organisations. Wrong slide. Spurgeon's, Gather and Exodus Youth Works. Our hope is to provide a really practical toolkit to help walk you through what partnership could look like, to answer some of the questions you might have, to maybe raise some questions that you might not have thought of, to provide toolkits and templates to guide you at whatever stage of the journey you're at. Because I think we really believe that so many faith groups already have it in them to kind of consider this partnership, and we'd love to just empower them to extend that hand. So there's a QR code here. We'll also be putting the link in the chat and sharing that with you afterwards. But what I'm going to do now is briefly walk you through this toolkit resource, with the hopes that you become slightly more familiar with it this afternoon, but also see the range of information included, and recognise that it kind of can help you at lots of stages of the process. So as I said, this toolkit includes loads of details. There's case studies, there's templates, there's questions, there's answers, and we hope that there'll be something in it for where you're at in the journey at the moment. Another key thing that we wanted to make sure was featured in this toolkit is that there's 2 user experiences. We as ChurchWorks are not only trying to support the church in working out how to partner with their local authorities, but vice versa. We're equally aware that sometimes local authorities need championing and encouragement in the way that they can better understand the faith sector and know how to approach them. So we've created these 2 user experiences. So both kind of actors can see the information that's relevant to them, have answers to the types of questions they might be asking. So in each section of the toolkit, this is kind of some screen grabs of what it looks like when you view it. It's a web-based toolkit. We have kind of overview information, but we've also offered a deep dive, some further resources and reading that you might be interested in if that's the real kind of question you're starting to unpick. Section 1 is all about why should we partner? Some of the information I've been sharing today. Why should churches get involved in family hubs? What are they? Why do they have something to bring? What could that look like? And then vice versa. Why should local authorities involve the church? Why should they be trying to extend the hand of partnership to the faith sector in running this public service? That's the kind of first section. Sections 2 and 3 are all about trying to understand the other organisation you might be partnering with. Section 2 is for local authorities, about understanding churches and the faith groups. How are they structured? What is their culture? Questions like who should you approach if you're interested in engaging? Should they go to the vicar, to a volunteer? Those sorts of things. Just helping to kind of demystify some of the ways that different organisations operate, particularly as we can often be in silos. Section 3 is the kind of reverse for the faith sector. So about understanding local authorities and the civic space. Again, how is it structured? Trying to pick some of the jargon to make it slightly easier to understand. And again, who should you approach? What does it look like in your kind of area, in your local council? Understanding the kind of different teams and internal dynamics there. Next, section 4 is all about building that partnership. In this section, we've tried to provide some templates of how to make contact for both organisations from the faith sector and for local authorities. For example, here for local authorities, how do they know what faith groups are doing what in their local area? How do they start to make contact? We provide some really practical tips and toolkits here to guide that. And I think another key question I'm sure Emma can share a little bit about later when she shares a case study is how do you engage with your kind of faith ethos in partnership work with a local authority? So we've also tried to address that of how as a faith group can you build trust with the local authority, and can you articulate to them what it means to be a faith group, to include faith in what you do, but also address some of those questions about proselytism and being in a kind of inclusive space. Next, section 5 is all about co-designing the family hub. If you've kind of started to partner and you've decided to collaborate on this project, then how do you go about making it happen? What does being a family hub mean for the church's space physically, mean for the activities, and how can you create things that suit the needs of both organisations? How do you go about having those conversations? Again, how can faith be articulated? We've used the really helpful language from the Keeping the Faith report that Theos produced of low fat, half fat, and full fat faith content and activities, and try to just start to raise these questions that I'm sure many faith groups have when considering partnering with statutory services of how do I communicate my faith, how do I stay true to that motivation, and yet also kind of become an inclusive space. So we've kind of raised some of those points and helped to try and guide you through that process. Finally, sections 6 through 8 is where we get really practical. We're conscious that if faith groups are to become official family hubs, it does require quite robust governance and safeguarding and training. So in section 6, we've tried to really clarify all that's required for a faith group to be official family hub. In section 7, we discussed the elephant in many rooms, funding, and we've provided some ideas and some opportunities to consider that might be relevant for this sort of work and work with children and families more generally. So there's some suggestions in that section we hope can be really helpful. And then finally, kind of parallel in section 8, we talk about measuring impact. I'm really conscious that for many grant funders and foundations, impact reporting is a kind of requirement of the application process. And so section 8, with that in mind, we're really highlighting how from the outset, measuring and kind of getting the kind of appropriate metrics can be built into the way that a family hub runs and operates, so that that's quite a seamless way to gather the information required and to see your impact. Now, I'm conscious that has been a super speedy whistle-stop tour, and I hope that I've just been able to kind of whet your appetite for this toolkit to highlight the range of information found in it. It's quite a chunky web-based toolkit, and definitely something to dip in at different points when you have different questions. But yeah, I really would love to encourage you to access that resource. We'll be sharing the link in the chat. Again, to reiterate, family hubs is a brilliant opportunity because it allows you as the faith sector to build upon what you're already running, what you're already facilitating in your community. And we hope that this toolkit will walk you through how to seek collaboration and how to seek partnership with the local authority. The final thing I wanted to share is, as ChurchWorks, I think we would probably articulate our role as kind of at the national, more denominational level of trying to encourage and empower both faith groups and local authorities, kind of like today and through this toolkit, to be able to partner with one another. But I'd also just like to highlight briefly one of our partners, Spurgeon's, who are really brilliant at providing that kind of more contextual and bespoke support. So I do really encourage reaching out to them. I can put a link to their website in the chat. If you're looking for that more kind of hand-holding in your local context, they're definitely better suited to provide that sort of work. Now I'm going to stop rambling and I'm going to invite Emma to join me. Emma facilitates a family hub in her church, and she'd be much better at describing that than I am. So I am going to ask you, Emma, would you mind introducing yourself, your church, a little bit about what it means to work with Family Hub, what that looks like, and then a little bit about the story about how that came to be?
Yeah, I can. Hi, I'm Emma Malcolm. Thanks so much for having me here today, and yeah, it's a real privilege to share about our Family Hub. So Bridge Community Church is in Bury St Edmunds. I noticed someone has put that they're from Bury today, not the funny one in Suffolk. Well, I am from the funny place in Suffolk, Bury St Edmunds. If you don't know where that is, if you drive to Ipswich, it's just kind of a bit left of there. So we're a bit more rural. We're not a big city, and we're a community church, and we have always had a heart for our local community. And we have always done lots of things within the community supporting them. But about 3 years ago, I went on a seminar similar to this, and I heard about family hubs, and I felt that was something we as a church could really offer to our local community. So our family hub is called Bridge Family Hub. As I said, we've been going 3 years. We had a look, first of all, at what we had and realised that we actually did an awful lot of things already. So within our family hub, we already had a stay and play, which was well established, well known in the community, a weekly coffee space, community grocery, which was in the basement of our church, and we had 2 or 3 sessions a week where people could come in and for a small amount use the grocery. We had a Ukrainian support group where Ukrainian people could come in and learn language, but also support each other, and also youth and kids activities. So we already had quite a lot already established. But we also had a huge need in our local community for children that were struggling with school. It had just come out of COVID. I was already supporting as children and family lead, lots of families who were struggling. So we felt that would be something that we would really, really like to develop. So what we did from that was we then went on to speak to our local county council and family hub teams and said, is this something we could provide? And 3 years on, we have continued with our Bridge Family Hub, and we run something called Bridge the Gap, which is a provision to support children who are not in education for any reason. And it's great.
Caravan sales.
Are you all still there? I think
Yes, we are.
Alicia.
We may have lost Alicia.
Will I keep talking until she comes back? Would that be helpful?
Yes.
I'm happy to do that. And then if she comes back, and then that's, oh, she's back.
Oh, there we go.
I'm sorry, did I disappear?
You did disappear, that's fine.
I would love to.
I'll tell you what, if I keep talking, Alicia, because I think you're dipping in and out, and then I'll go to the next question, shall I? Is that okay? Great. So yes, so Bridge Family Hub is well established, but we had some real key learnings that we did over the time, and I'd really want to share those with you today. When we started our hub, we didn't have the toolkit, and that's only come into place this year from ChurchWorks. So we were kind of just really not sure where we were going. And I think we would have been better to spend more time in preparation beforehand. So if you are thinking of running a family hub, if you are looking at this model, please do access the information out there. Obviously, the toolkit is amazing. I spoke to one of the people who designed that beforehand, and obviously got her information and support, but the toolkit as it is now is great. So using that information, as Alicia's already mentioned, Spurgeon's Children and Families Charity are fantastic. They will journey with you at that initial time of you starting a family hub to as you progress. You get coaching from them, you get lots of information about how to just try things out. They will actually come to your church and support you through that. So they're a really good opportunity to dip into. And also visiting other churches. We did go down to Yeovil and have a look at that, but you need to get that preparation done, because once the family hub starts, there is no time to put the prep in. So policy writing, think about your funding, all of that. It's really good to start with that. I think as well, I was thinking, what else did we, and key learning was, again, Alicia, you already mentioned this a little bit, but it is building connections. And those connections become relationships, which is really important. So when we started off, we're in Bury St Edmunds and Suffolk. I have 3 councils that I have to work with: town, district and county. I thought there was just one at the time. That was a big mistake. So actually getting to know our local councillors was really important. They're the people who really not only hold on to finance, but know what's going on in the community, and are really a great asset to have supporting you. We've worked really closely with our town and district council. The mayor now comes into Bridge Family Hub and uses it as her space. She's often in for a coffee. She has her own cup because she just feels that she's at home there. And our connection with her went on from being a connection to a relationship. So relationship building is really, really important. And the same with connecting with other family hubs. When we decided to take this on, we went to the county council and tried to work out who best to partner with and support. So we have partnered with what was Early Help, is now Family Support, and I work closely with them. So for the activities we do, for safeguarding support, we have family support workers who attend Bridge the Gap. We're just working alongside them all the time. And that again has taken time to build up that relationship, but it is really important because you are offering your community a joint service. It's not just us standing alone as a church. We're working together to be able to provide this support. So actually building those relationships is really important. And just as Alicia, I think, said before, and Sarah said as well, encouraging people to come and see what you do. When you're chatting on a Teams meeting, it's really hard to know what really goes on. You can see my little pictures there, but it doesn't really give you a complete explanation of what's happening. Encouraging people into your church or your faith organisation and just saying, this is who we are and this is what we have to offer, makes a whole lot of difference. And I think it dispels a lot of myths as well about perhaps who we are. Yeah. Alicia, back to you.
Brilliant. Thank you so much, Emma. And one final question to finish. I'd love to hear about your experience of kind of sharing the idea to partner with the local authority, how they received your kind of extended hand for partnership, and what advice you'd give other faith groups who are hoping to do that in their community.
Yeah, I think when we started with our local authority, first it took a long time to find the right people and the right connections. So you have to be quite persistent because local authorities are big, aren't they? And they're huge and there's lots of pockets. I now work with the education side, I work with social services side, early help. So finding the right connections, because their time is precious too. And suddenly if you have a church come in and say, hello, can I speak to you? I want to tell you about this. And you're in the wrong direction. So finding the right people is really, really important. And then when you have done that, it's actually saying to them, how can we support you as much as this is what we have to offer? Because they're under huge pressure. And for us to come in with a wonderful idea and all they can see, as you can see in my pictures, as sand and diggers, that might not really be the right kind of thing for them to be thinking about at that time. So actually saying, what are the needs? These are needs that we might be recognising, but how does that fit with you? Our local authority has been great. I have partnered with the family support team, the early help team now for those 3 years. We have the family support workers in regularly. They hold their meetings in our building now, and we have kind of open door between each other. They know we're a faith organisation, and that's never hassled them. We're probably more concerned about that a little bit than they are to us. They are really open to what we're doing, and it's continually building up a relationship. And I think the other thing to think about is local authority changes on a regular basis. Departments change, people get moved across. So you're constantly, if you're in this role, you are constantly networking. So you need a bit of energy for that to network, but it is worth doing.
Amazing. Thank you so much, Emma. That's really helpful to have a kind of real life story of what this looks like and your experiences. Yeah, really valuable. I'm aware of time. We're about to hit 3 o'clock, so I'm going to hand back to Esther to wrap us up this afternoon.
Great, thank you, Alicia and Emma. Yeah, really, really great to go through the toolkit and to hear about Emma's experience of working in family hubs. And thank you to all of you for being with us this afternoon and for bearing with us as we kind of whip through lots of information. There are 2 key things that I just want to mention before we go. One is that we are very excited that we have our ChurchWorks Summit coming up on Friday the 27th of February, and that's going to be an opportunity for us to gather church and representatives from government and from public services together to talk about how do we continue to do this partnership work. And so we would love to have you join us. And then the second thing is the summit will be in person. Sorry, thank you for that question, Kate. The summit is in person and it will be in Westminster. But the details will be on that link. And then we also just wanted to invite you to sign up to the ChurchWorks newsletter, where you can continue to hear about events like this and other pieces of work that we have going on. Both of those links, and then also the links to the resources that we've shared today and the slides, will be sent in a follow-up email to everyone who's signed up. So you will have those coming to you over the next couple of days. Thank you so much for joining us. Thank you for your time, and we hope to see you at another event soon.